Hello and welcome to the first in a series of short video lectures that are going to help you revise for your assessments and reinforce some of your learning. So the first one we're going to look at is flag systems in physical therapy. So why do we have flag systems? It's a process that we engage in to make sure we're safe for our patients. If you want some further reading around this, please do consult, as you can see there, the pre-reading that I've put on Moodle for red flags. So, flag systems in physical therapy. Does this patient need modified or alternative interventions? When they sit in front of me, I meet them for the first time and we do our subjective and our objective assessments, I need to answer that question immediately. Do they need something else? Am I the right practitioner for this patient? Okay, so this flag system will help us do that. And there are different types of flags and we've grouped them into colours. So we've got our red flags, which are things like tumours, fractures, cancer, etc. Immediate referral for emergency medical attention, right, physically. We've also got orange flags. These are a relatively new addition to the flag system and therefore anything that might indicate that we think there is some serious psychological issue going on. So have they expressed suicidal thoughts? Are they at risk of harming somebody else? Have they got clinical depression or psychoses, that sort of thing? We've also got our yellow flags. Now these are also psychological, but these are things whereby we might be able to support them. We still might need some referral, but it's not an emergency. So are they in extreme fear about their injury and we can help change that? Do they think that they can't cope and they've got to get acupuncture or massage? Can we help with that? So they're psychological and emotional. We've also got our blue flags, their perception of how can they get back to work or is work going to make it worse? And then the more systemic things. So is there something to do with the arrangement of their work, their boss, discrimination that is also contributing to this condition? But we're looking at red flags, okay? And red flags are our markers or signs that raise our suspicion that something serious might be wrong or might go wrong. So it might lead to death, disability, serious injury, or they might have an underlying illness. And we need to look at these to help identify risk. So what are they? As we've just said, identifying risk can help us triage. Triage means organising what should happen next with this particular patient. So how do we recognise red flags? Well, obviously we've got to examine the patient. We have to talk to them in our subjective, and then we have to do our objective assessment. Most of these, if not all of them, these red flags will come up in the subjective as long as you are attentive to detail, so you ask the right questions, listen to the answers, and you have a knowledge and understanding of all the different red flags. And if we find them, what do? We have to support the patient in arranging urgent medical attention. That might be that you arrange for them to go and see their GP, you might direct them to the accident and emergency department, or you might actually call 999 if it's that immediate. If in doubt, seek some support. What does the research say about all these red flags we'll look at in a minute? Well, it says they're not diagnostic. So if we see one or more of them, we can't make a diagnosis, but they would just raise our suspicion of that. In the literature, there's no consensus. No one is in full agreement of how reliable or valid these red flags are. So they can't really be algorithmic a lot of the time. I.e., you can't say, if you see this, do X. Right? And it's an ongoing process. We don't just assess red flags in the initial consultation, we also do so every time we see the patient. Now these are the big long list, okay? We've asked you to identify at least 4 but up to 10 for your assessment. In yellow there you can see if you've got at least 2 of those, so a cluster of 2, that patient needs to go to hospital immediately because it may indicate they have cauda equina syndrome. As you can see there in blue, that's one of our key red flags when we're treating, because if we're not too sure, but it kind of looks weird, it doesn't really respond to the treatment, it's got an unusual pattern, that could be, or that is a red flag sign or symptom. But we are looking for clusters, so 2 or more of these things together. Here's an example. On the left there you can see some curvature of the nails. So back on here we had down the bottom on the left hand side, unexplained soft tissue lumps. We've got nail, skin, mole or nipple changes. So this kind of nail clubbing you can see here is maybe associated with things like inflammatory bowel disease, cardiovascular disease, liver disease, AIDS, etc. You don't have to remember all of those, but you need to know to recognise that it looks atypical. On the right hand side you can see some swelling around the joints that may indicate rheumatoid arthritis, and then down below some gross swelling in the calf and skin changes that may indicate a blood clot or deep vein thrombosis. So in conclusion, what are these red flags? Well, they are indicators of suspicion of serious conditions, and we need to assess them to see how at risk our patient is and if we are the right person for them. How do we recognise them? Well, obviously through our examination, attention to detail, and having an awareness of all of the different types. So if we find a cluster, we combine that with our clinical hunch, our experience and our learning, our knowledge and understanding, and we look at the best available evidence because we have to keep up to date with this. And that leads us to our decision, which is either refer or monitor them and continue our treatment. What do I do? Well, as we said, support arrangements for urgent medical attention. What does the research say? Well, we lack a consensus, but we've got to maintain our evaluations over time. That is a micro teach of red flags. If you enjoyed it, please let me know. If you want to see any improvements or you've got any feedback for me, again, let me know. Email me mcole@uel.ac.uk or tweet me at coletherapyed or see your reps. Thank you, and I look forward to the next one.